Healthcare delivery systems and occupations. After completing this module, you will be able to identify the basic components of the healthcare delivery system, describe the various types of healthcare providers and the available range of services, describe the composition and functions of a healthcare team, and identify the general roles and responsibilities of the individual members of the healthcare team. A healthcare delivery system is a group of healthcare providers or agencies that provide services and resources to meet the healthcare needs of the people. Examples would be hospitals, laboratories, diagnostic imaging, rehabilitation, and doctors' offices. A healthcare provider is the individual clinic, hospital, agency, or organization that is concerned with health promotion to reduce the risk of disease, detection and treatment of illness or disease, rehabilitation to regain some or all functions, long-term care or assisted living. The term healthcare provider is also used to describe individual practitioners such as doctors, dentists, physical therapists, nurses, licensed massage therapists, and others in the healthcare occupation. There are over 6,000 hospitals in the United States, and most of them are general or sometimes called regional hospitals. Hospitals usually have multiple services available for the person with acute illness or injury, which means a sudden onset with expected recovery, terminal illness or injury, end stage of a disease or multiple injuries with low chance for recovery, and chronic illness, which is long-term illness with the need for an ongoing, continuous treatment and care to prevent complications. Who owns the hospital? Voluntary or nonprofit hospitals operate under religious or other voluntary groups. A board of trustees or individuals selected from the community's business and professional people are the overall decision makers who serve in this role. The overall management of the hospital is by an appointed paid hospital administrator. Examples in the local area of a voluntary or nonprofit hospital is Central Florida Health Alliance and also South Lake Hospital. Proprietary hospitals are for-profit hospitals which are owned by a large corporation. The corporation usually owns groups or chains of healthcare facilities in several states. Now it's time to test yourself. A blank illness has a sudden onset, but the patient is expected to recover. Is it a chronic illness, terminal illness, acute illness, or long-term illness? If you answered acute, you were correct. Outpatient facilities. Patients who do not require hospitalization are often seen in private facilities for ambulatory or outpatient services. These facilities will typically fall into one of the following categories. Groups of doctors or physicians, examples in the local area, would be Lake Primary Care or Lake County Primary Medical Care. Dentists and dental surgery offices, and local ones would be New Age Dentistry and Central Florida Oral Surgeons. Another group would be groups of physicians of one specialty. Claremont Pediatric Dentistry, Lake Pediatrics, Lakeside Gastroenterology, or any of the local obstetrics and gynecology offices. Optometric offices that do eye exams and glasses. Eye Care Center of Leesburg is an example. Same-day ambulatory surgery centers. Claremont Ambulatory Surgical Center would be a local one. Minor emergency clinics or urgent care centers. We have several in this area. Lake Regional Urgent Care, Express Care, Centricare are a couple examples. Rehabilitation clinics. Lake Center for Rehabilitation is one example. Rehabilitation and physical therapy offices. Florida Musculoskeletal Institute, Lake Center for Rehabilitation, and Advanced Physical Therapy are the examples of that. Subacute care facilities. Hospital stays have gotten much shorter over the last several years because of the reduced insurance coverage for most illnesses and injuries. Patients who are still in need of medical care or extended rehabilitation can be transferred to a subacute care facility. Subacute facilities may be located as a branch of the hospital or of a nursing home. If the patient does not recover or improve enough to go home, then they are often transferred to a long-term care facility. In the local area, most of the nursing homes do have a unit for subacute. Long-term care facilities. A person who is unable to care for him or herself at home, but does not require hospitalization, is usually placed in a nursing home or nursing center. The patient is now a resident and is provided with nursing care, medical care, social and recreational care, and any rehabilitative care needed. Do not think of the long-term care resident as only elderly persons. Sometimes the residents are young persons with birth defects, severe injuries, or illnesses. And one that we see locally is multiple sclerosis, because they're frequently in their 40s or early 50s, cannot take care of themselves, and family members work or they have children at home, so they have to go into long-term care to be taken care of. Examples would be Avante of Mount Dora or Avante of Leesburg, Waterman Village of Mount Dora, or Lakeport Square. Home health care agencies. Patients sometimes need some type of periodic nursing care, extended patient or family teaching, or a nursing observation, but can still be in the home with family support. Types of home health care agencies are Public Health Department, and we have Lake County Health Department and Community Health Center, and private nursing agencies. Examples would be Advanced Nursing Concepts, Granny Nannies, and House Call Home Health Care. Another type is hospice. Hospice is a healthcare agency or program that cares for the person who is terminally ill or at the end stages of his or her disease. Individuals who work at hospice are specially trained to provide the physical, emotional, social, and spiritual needs of the patient and family. They involve the family in the patient's care and provide as much quality and comfort as possible. Hospice care can be provided in the patient's home, in a unit within the hospital, in collaboration with care in a long-term care facility, or in a freestanding hospice facility. An example of the hospice in this area would be Cornerstone Hospice, and they have a freestanding facility in Tavares, and they also have one in Lady Lake, and I think there are a couple others. I'm not quite sure where they're located. Purpose of healthcare providers. The main focus or purpose of all healthcare providers is to provide quality care based on need, prevent illness, injury, and loss of function, promote recovery and health, use multidisciplinary healthcare teams. That means they use all the different professions. If you're interested in more of these, at the last there is a page with the different websites on it. Now test yourself. Which type of facility would be best suited to provide care for someone who no longer needs hospital care, but will need extended rehabilitation for the next 2 weeks? Is it A, subacute care facility, B, a long-term care facility, C, a home health care agency, or D, hospice? If you answered subacute care facility, you would have been correct. And here's the list of websites. We have Central Florida Health Alliance, South Lake Hospital, Avante at Leesburg, Waterman Village of Mount Dora, Lakeport Square, Lake County Health Department, Advanced Nursing Concepts, Granny Nannies, House Call Home Health Care, and Cornerstone Hospice.